All right, as we're starting, please let us invite up the podium for his opening, Dr. Ejike Oji. A round of applause for Dr. Oji as he comes to give us his opening remarks. Please let's celebrate him. We can do better. Thank you.
Wow, wow, wow. Can I get another round of applause from everybody? It's such a wonderful morning. Months ago, when we started planning this conference, we knew that today would come. But we didn't know it was going to be a very lovely looking morning and day with all the important dignitaries from around the world and in Nigeria being here. So let me just do the little protocol that I understand. Permit me, don't kill me if I miss out anything. But I'm sure as we go on, we'll recognize everybody that is here. Let me start by, first of all, recognizing the Honorary Coordinating Minister of Health and Social Welfare, Professor Ali Pate, who is represented here by Dr. Sam Oyeni, the Head of Reproductive Health Division. Please welcome him properly. I would like to welcome my digital board chair, Sarikin Yaki Gaji, Alhaji Sani Umar, who is the board chairman of AAFP. I also like to recognize our founding chairman of the management committee, Professor Ladipo Oladapo, a gynecologist of note and the doing in the reproductive health sector. I also would want to welcome other members of the BOT, Professor Adema that is here present. I also would like to recognize other members of the management committee. I can see Philip Amoma here. You're welcome. Also to recognize and welcome the director of the Gates Institute, Dr. Philip Anglaiwiz. You're welcome, sir. Please also help me welcome Rodio Diallo, the Deputy Director of the Gates here in Abuja. Please give her a good warm welcome. Also, I would like to welcome the Executive Director of the FP 2030, Dr. Sam Dube. Can you welcome her very well? She's always looking 16-ish. Give her a good round of applause. Also, please welcome Dr. Gertrude, this is the girl of the USID. You're welcome, Gertrude. I also would want us to welcome Abigail from the UNFPA, the head of office in the UNFPA. Represent UNFPA in the room here too. I'm looking forward to see Mike Kempler, who is the executive director of Sexual and Reproductive Health and Rights at SIF Foundation. I haven't seen him in this room, but I know he's on his way. I will now also like to welcome my dear brother, Dr. Mohamed Leki, who is the chair of the Health Sector Reform Coalition. Mohamed, you're welcome. Let me use this opportunity to welcome all the other development partners here present for time and applaud them for being here. And I would like to also welcome everybody that has come from far and wide, especially our colleagues from the States. I know that a lot of the family planning coordinators, the people that really make sure that family planning gets to the last mile, please give them a very good, warm applause because of coming here. Then I'm leaving the last for the best. Let's also welcome the media. The media, anything we say in this room, if the media doesn't carry it, we are just talking to ourselves. So ladies and gentlemen, let us welcome the media, ladies and gentlemen in this room. And then finally, the young people, can you really applaud us, make some noise, let's know we are here. When we were planning this, we made sure that 25% of the people in this room will be the young people of Nigeria. And they didn't prove us wrong. Give yourselves a good round of applause. I would now like to just read my welcome. because today we've looked forward to it. So permit me to welcome you, distinguished guests. It is an honor to join the Honorable Coordinating Minister of Health and Social Welfare in welcoming you to the 8th Nigerian Family Planning Conference. The gathering is a momentous occasion, as it is not only something that represents our collective commitment to advancing family planning, but also ushers in the midterm accountability year for the FP 2030 stewardship. This year's conference comes at an important moment as the Coordinating Minister of Health and Social Welfare champions the sector-wide approach agenda, a unified platform designed to streamline health programs, strengthen accountability, and achieve transformative results. The FP 2030 also, for the first time, is holding the global board meeting in Nigeria, which highlights the importance of this conference. May we please applaud the AD for bringing them here. Thank you, ma'am. We are really very grateful for that move. Let us embrace this opportunity to align efforts, inspire innovation, and renew our commitments to family planning as a key driver of sustainable development in Nigeria. As a background, family planning is far more than a health intervention, as it is a transformative tool that empowers individuals, strengthens families, and accelerates its national development. It saves lives, reduces maternal and infant mortality, promotes gender equity, and also advances social and economic progress. The evidence is clear. $1 invested in contraceptive services saves $3 in maternal and newborn health costs by reducing unintended pregnancies. These savings unlock critical investments in education, infrastructure, and healthcare, fostering the conditions needed to achieve Nigeria's demographic dividend. In Nigeria, family planning programs are making strides, but challenges persist. Disparities in access shaped by regional, educational, and socioeconomic differences continue to deny millions of women and girls the autonomy to make decisions about their reproductive health. Globally, over 222 million women in developing countries face an unmet need for modern contraception, underscoring the urgency of our shared mission. The global family planning movement, catalyzed by initiatives like the 2012 London Summit on Family Planning and the 2030 Partnership, has galvanized action worldwide. While progress has been made, the unmet contraceptive needs and low contraceptive prevalence rate in Nigeria signal the need for intensified efforts. As we recalibrate our goals under FP 2030, this conference serves as a rallying point to accelerate our shared commitment to universal access in family planning. Let us look in Nigeria's commitments. Nigeria's commitment to family planning is anchored in bold policies and partnerships. At the 2012 London Summit on Family Planning, the Federal Ministry of Health, led by Professor Ali Pate, the then Minister of State Health, now the Honorable Coordinating Minister of Health and Social Welfare, working alongside the Association for the Family, for Advancement of the Family Planning. I remember that year Professor Ladipo represented at that conference. Please give him a good round of applause. Outlined ambitious goals to strengthen advocacy, improve supply chains, and promote innovative solutions. The commitments were renewed for FP 2030 with a stronger and more determined collaborative effort to show results. Despite these milestones, Nigeria's contraceptive prevalence rate, CPR, marginally increased to 15% from 12%, with unmet need at 21%. High fertility rates, coupled with low family planning uptake, contribute to poor maternal and child health outcomes and exacerbate rapid population growth. These challenges demand renewed urgency, innovation, and collaboration to achieve the FP 2030 targets. Subsequently, the Nigerian government demonstrated growing dedication and marched words with action and released $4 million for this counterpart support that has made it a very major landmark pronouncement and taking every laudable initiative to tackle our growing population. May we applaud the federal government for that. Namely, the renewed commitment to the FP 2030 Global Initiative, setting a financial target of 1% of the health budget to be set aside for FP. The launch of the strategic plan for the implementation of the revised population policy, and the setting up of the Population Advisory Group at the National Population Commission. Integrating family planning into the healthcare provision fund, also to guarantee free services for marginalized groups, and introducing initiatives like the MAMI program to recruit skilled health workers and enhance service delivery. The conference should therefore be a place to start the focus on the last mile concept to get all these done. The March 2030 agenda, FP 2030 agenda, would also be in focus to help government galvanize all stakeholders to meet the targets. Let us now look at the conference that we are all gathered for. The theme is sustaining commitments for family planning within the Nigerian Health Sector Renewal Investment Initiative, advancing progress towards achieving FP 2030 goals. Ladies and gentlemen, you could see there is an alignment and realignment of the AFP with the government to make sure that the conversations we're going to have in this conference aligns with the sectoral approach and then also the transformative swap agenda the federal ministry has brought on. We looked at the sub-themes from policy to practice, bridging the gap for effective planning, family planning service to the sector-wide approach. This theme focuses on translating policies into practical and chewable family planning services by utilizing a coordinated sector-wide approach. It emphasizes collaborations across sectors to enhance the accessibility and quality of family planning programs in Nigeria. It will also allow insights into government's unfolding initiative in having one family planning program where no state or person is left behind. 2, advancing family planning through strengthened multi-stakeholder accountability. Rights-based quality services and total market approach. It is now becoming very imperative that for government to succeed, there has to be a new way to do things. And that's why the total market approach is now being implemented. The UNFPA supported the Federal Ministry of Health about a year ago to develop a comprehensive strategy on total market approach. Advanced advocacy and resource mobilization, advancing sustainable financing, the family planning programs. The theme highlights the need for continuous advocacy and resource mobilization to secure sustainable financing for family planning. It will focus on ensuring long-term funding for family planning initiatives, particularly for commodities providing broader choices and access for women and adolescents in both public and private sectors. Addressing equity, inclusion, and vulnerability in family planning programs in Nigeria. This theme addresses the importance of making family planning programs in Nigeria more equitable and inclusive, especially for vulnerable populations, marginalized populations, and persons with disabilities. When we were doing this conference, we made sure we had a sub committee of DEIs, which will look at diversity, equity, and inclusion. For want of time, I have this in the destiny. You could read it later. Let me just run through the major highlights. The next one was leveraging technology and innovation to improve family planning services in Nigeria, leveraging the private sector for investment and expansion of right-based quality family planning services, enhancing investments in the next generation, ensuring right-based reproductive health services for adolescents and young people, strengthening investment in faith leadership, community, and health systems for improved demand generation for family planning in Nigeria. The conference goal is to catalyze sustained commitment and collaborative action among stakeholders to advance progress in family planning initiatives in Nigeria with a specific focus on bridging the gap between policy and effective service delivery on the ground. And then we'll have the specific objectives down there. So let me just say that the conference was conceived as a platform for collaboration, innovation, and accountability. Every 2 years, this event brings together experts, policymakers, partners, and stakeholders to share experiences, assess progress, and identify pathways to improve family planning service and reproductive health outcomes. So this year's conference is particularly significant as it coincides with the release of the PMA and 2030 Nigerian Demographic Health Survey data. The findings highlight progress and challenges in our journey toward achieving FP 2030 goals. Through dynamic discussions, innovative solutions, and actionable strategies, this conference aims to bridge the gap between the policy and practice, ensuring no one is left behind in our achievement of universal health coverage. Let us look a little bit at our achievements as an organization. The Association for the Advancement of Family Planning, in partnership with the Federal Ministry of Health and other stakeholders, have achieved remarkable milestones over the years. Number one, we successfully advocated for counterpart funding for FP, about $3 million and now $4 million for family planning commodity procurement that ensures free services in public sites. Development of grant proposal to attract donor funding for family planning programs, establishing accountability scorecards to track family planning investments in the country, training civil society organizations to monitor and advocate for accountability at the state level, partnering with the media to drive family planning advocacy nationwide, engaging religious leaders to build consensus and promote family planning services, advocating for at least 1% of the national health budget to be allocated for family planning. These achievements underscore the power of partnership and impact of sustained advocacy in advancing Nigerians' family planning agenda. Like you can see, the meeting structure we're going to have, we had 3 pre-conferences predating today. On the first day, on Monday, we had a pre-conference of the youth. It was a very vibrant conversation. Can we give them a good round of applause? They were truly in their mettle that day. Then the following day, which was yesterday, we had also the interfaith and then also the women. We deliberately chose these 3 groups. Number one, the women are the ones who take services. The youth are the ones that will drive our population to 450 with the recent fertility rate that we have. And of course, the interfaith are the ones that look at social norms. So ladies and gentlemen, I would like to welcome you as we come together for this important conference. Let us remember the immense power of collaboration. Family planning is not just about meeting targets. It is about transforming lives, empowering women, and building a healthier and prosperous Nigeria. We encourage you to actively share your insights and explore the wealth of resources available on our conference website and app you will download on your Android or iPhones. They will give you a pleasurable experience through the conference. Together, we can drive the change needed to achieve the FP 2030 goals and create a future where every woman and girl has the opportunity to thrive. Thank you for participation and dedication to this issue. Let us make this conference a success. Thank you so much.
Please, another round of applause for Dr. Ejike Oji. Thank you so much. We're already behind schedule, so we need to move on fast. But before then, let's quickly recognize Mr. Emmanuel Aja, Country Director, MSI Nigeria. Thank you so much. Please, a round of applause for him. Thank you, sir. While we're on, Dr. Kai Haruna, Executive Director, Planned Parenthood Federation of Nigeria, PPFN, walked in. Dr. Kai, you're welcome. And right beside him is Dr. Leki Mohammed. Dr. Leki Mohammed, good morning and thanks for joining us. We also have Tracy Bird. Tracy Bird is CEO and Gender Health. Tracy, you're welcome. Please, a round of applause for Tracy. Dr. Stanley Okbai. Dr. Stanley Okbai is the Director of Projects, Development, Research and Project Center, DRPC. Dr. Okbai, you're welcome. A round of applause for him. Also here in our midst is Chief Tonte Ibraye, Executive Director, White Ribbon Alliance, Nigeria. Chief Tonte, you're welcome. And we have some commissioners from the different states. We have the Honorable Commissioner of Health, Kebbi State, Comrade Yunusa Musa Ismail. Okay, where is he? You're welcome. We also have another royal father who is in our midst, Sarkin Sudan of Vuruno, Al-Haji Kabiru Chigari Al-Hassan. Please, a round of applause for him, our royal father. If he's somewhere at the back, please can we bring him forward to come and sit somewhere in front. Thank you so much, Sarkin Sudan of Vuruno. We also have a representative of the Commissioner of Health, Katsina Farm Adamu Suleiman. A round of applause for him. Commissioner of Niger State Primary Healthcare Representative, Dr. Abdullahi Imam. A round of applause for him as well. And also we have in our midst, Dr. Aisha Abubakar, Permanent Secretary, Ministry of Health, Kaduna. Dr. Shehu Sambo, Executive Director, Jigawa, SPHCDA. The representative of the Commissioner of Kano State, Dr. Shehu Abdullahi, Director, Medical. Okay, please, a round of applause for them.